Bienvenidos chicas y chicos a un nuevo video de conmigo Black 100. Aquí conmigo Black 100 comentando. Y ay, aquí estoy yo. Bueno, como decía, bienvenidos a un video nuevo. Estoy en una cirugía que no sé qué es. Before you scrum in. ¿Qué será? ¿Qué será? ¿Qué asco será? ¿Qué asqueroso será? ¿Qué asco será? Bueno, ya se cargó. Se cargó este más rápido que los otros.
Welcome to Surgery Squad's virtual root canal procedure. I'm the one and only Dr. Jeff, and I'll be helping you with this surgery today. A root canal is an endodontic dental procedure that's used to repair and save a decayed or infected tooth. During a root canal, your dentist or endodontist will remove the pulp tissue within the tooth. Once everything is removed, clean out any contaminants inside the tooth and seal it to prevent any further infection. Our patient today is having a root canal performed on their lower right second premolar. A dental professional may refer to this tooth as tooth 29. Before we begin, would you like to review some of the common myths and misconceptions surrounding root canal treatment? No problem. Let's move on. In an effort to make our patient as comfortable as possible, we need to inject a local anesthetic into their gum line. But first, apply a topical numbing gel to the injection site. This will help reduce any discomfort the needle may cause. Next, we can inject the local anesthetic. After the local anesthetic has taken effect, the area should become numb for a few hours. Use the syringe to inject the local anesthetic into the patient's gums. Just below the tooth, we'll be performing a root canal.
Algunos que he visto la inyección es wow, pero mira qué jeringa más grande. ¿En serio la quieres? Te la subo. Ay, Dios mío, no. Ay, Dios mío.
Let's give our patient a few minutes to relax for their mouth to become completely numb.
Dios mío. 5 minutos después. Oh, Dios mío.
Now that the patient's mouth is numb, we can move on to isolating the tooth. Since our patient's saliva contains contaminants that we don't want getting into the tooth, isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber dental dam and place it over the tooth.
Según yo, esto se va a poner aquí. Toma.
Once the rubber dam is in place, put on a tooth clamp to keep it from moving.
Ok, esto va a ser lo peor.
Next, we'll need to dry out the tooth as much as possible using our air-water syringe.
¿Pero qué? Bueno.
So far, so good. Now that the tooth has been isolated, we can create our access cavity in the tooth using our drill.
No, me está diciendo que voy a perforar. Mío. Entonces dice que
the next step is to clean and shape the tooth's canal using a root canal file. Go ahead and give it a shot.
¿Qué? No. Vamos a talar. Ay, qué asco.
At this point, the dentist would measure the depth of the canal using a combination of x-rays and specialized equipment. If a dentist fails to measure properly, it could mean that the tooth would be at risk for reinfection. Now we need to clean the canal of the tooth using sodium hypochlorite, commonly known as bleach. We'll let the bleach sit in our patient's tooth for about 5 minutes to make sure that all the bacteria and tissue inside the tooth has been dissolved.
Dios mío, ¿cómo aguanta? Sí, me hubiera vuelto loco.
Now use the suction to remove the bleach from the patient's tooth.
Lo voy a tener. Dios mío, pero yo pensaba que era resina. Era agua.
Next, we'll need to fill the tooth
Dios
using
mío,
a
quítenle
rubber
la
content
licencia a
known
este
as
doctor.
gutta percha. Gutta percha is often preformed as tiny, thin cones that we'll insert into the clean canal of the tooth. I've already added some sealant to the gutta percha cone. Let's see what you can do.
Dios mío.
Looking good. A heated instrument is now used to remove the excess gutta percha.
¿Pero buena suerte para eso? No, usted está loco.
Pack the gutta percha into the tooth canal using a plugger.
No te me toqué la muela y ay, Dios mío, creo que voy a necesitar hacer esto. Pero, ay, no, qué asco. ¿Qué? Pero...
After the gutta percha has been placed, it is common that additional x-rays are taken to verify that the canal has been adequately sealed off. Once the dentist verifies that the canal has been sealed, a filling or crown is placed, depending on the location of the tooth. You can learn more about fillings and crowns in our virtual dental filling and virtual dental crown procedures here on SurgerySquad.com. After a root canal, patients should expect some mild sensitivity and discomfort. This can usually be relieved using over-the-counter pain medication, such as ibuprofen or naproxen. By brushing twice a day, flossing daily, scheduling regular dental visits, and avoiding smoking, it is possible to greatly reduce the need for a root canal.
¿Cómo?
And that's a root canal.
Oh, ya tenemos.
Why not check out some of our other amazing surgeries here on SurgerySquad.com.
¡Viva! Ay, qué asqueroso. Solo la cirugía. Sesión cirugía virtual. O cirugía virtual. Sección de ustedes me entendéis, pero o un double master combi no quiero ver más, pero ahí voy a hacer otra más y ya lo dejo aquí. Oh, qué asco, qué asco, la peor parte de mi vida, de hecho. Y ya empecemos. Sí. No, en serio, estoy a punto de vomitar. Ay, Dios mío, no. Estoy a punto de pausar el video, irme a vomitar un ratito y ya.
Welcome to Surgery Squad's virtual cesarean section. I'm Dr. Jeff, and I'll be guiding you through this surgery today.
¿Por qué se llama Dr. Jeff?
A cesarean section, commonly referred to as a C-section, is an inpatient procedure.
¿Por qué se llama como una creepypasta,
in a woman's abdomen and uterus to deliver a baby. This procedure is often performed when a physician determines it to be a safer delivery option for the mother, baby, or both. As with any surgery, the use of alcohol and tobacco increases the time it takes to recover, and if the mother has used alcohol or tobacco products during her pregnancy, it can also cause serious birth defects. Our patient today is in her early 30s and is relatively healthy, with exception of a brief history of high blood pressure. Luckily for us, we get the opportunity to deliver her first baby. Now that we've covered the basics, let's scrub in. We'll begin the procedure by inserting an IV into our patient's hand so that we can provide her with any medication and fluids she may need. I've already tied a tourniquet on the patient's upper arm. Can you find a suitable vein in the patient's hand?
Yeah. That's okay.
Looks good to me. Next, we need to sterilize the insertion area using an alcohol wipe.
Okay.
Now that the area is disinfected, it's time to insert the needle and advance the angiocatheter into the vein. Take a stab at it.
Dios mío, ¿y ahora para qué la inyección? ¡Wow!
The small burst of blood that you just saw in the angiocatheter hub is known as a flashback. This lets us know that the angiocatheter is correctly positioned in the vein. Now, I'll release the tourniquet. While applying gentle pressure over the vein to collapse it, you can remove the needle. This will reduce the amount of blood that may pour out of the angiocatheter while the needle is removed. Once you remove the needle, I'll properly dispose of it in a sharps container.
¿Qué? Ahora voy a tener que sacarla. Oh, Dios mío, no.
I'll lock the IV tubing to the angiocatheter by rotating the locking mechanism. And finally, we need to secure the IV with tape and test the IV line. Excellent job. Was it easier than you thought it would be? In order to reduce the amount of discomfort our patient may have, we'll be giving her a spinal anesthesia. This differs from an epidural in that we'll be injecting the anesthetic directly into the spinal fluid that surrounds the spinal cord, and there's no catheter involved. First, clean the area using iodine-based antiseptic solution.
Dios mío, esto es muy hardcore. Esto es muy hardcore. ¿Dónde quieres, malditas? Toma, toma. Todo el cuerpo. Toma. Sexymente. Neta serie. Creo que son las partes en donde me deja. Es en donde necesita el paciente. Pero en donde no puede. Porque de hecho hay uno antes que es de un dedo, creo. Me dio tanto asco esa vez.
Next, we'll inject a local anesthetic to decrease the pain the patient will feel when we inject the spinal anesthetic.
También tengo uno de algo más. Dios mío, y ahora inyecciones. Una ahí, otra de aquí y otra aquí. Oh, Dios mío.
So far, so good. Now we need to inject the spinal anesthetic directly into the patient's spine.
Ahora tenemos que inyectar la columna. Dios mío, pero qué hardcore.
Now just place a bandage over the injection site and we'll move on. Great. Before we can make any incisions, we need to clean the patient's abdomen with antimicrobial iodine solution.
Ay, no puedo hacer como pero bueno. Tengo que llenar toda esa panza y hay algo que me gusta mucho a mí. Tatito. Y es de que se mueve hasta las piernas, wow. Dios mío, aquí debe de estar un gran bebé que está hasta las piernas. Bueno, continuemos.
Now use the scalpel to make the abdominal incisions. As the incisions are made, you'll need to separate the layers of tissue, fat, and muscle. Are you ready?
¡Oh! Le voy a...
It's getting a little messy in there. Use the suction to clear out some of the excess blood and fluid.
Y es que esta me guiña. Dios mío, Dios. Oh, por absorber la sangre, aunque se tiene en esto.
Insert the retractor to push down the patient's bladder.
¿Qué? Dios mío. Oh my God.
Make an incision into the patient's uterus so that we can begin the delivery. Be careful though, we don't want to accidentally injure the baby.
Hija de su madre. No. Oh!
We're almost there. Sometimes a surgeon will need to use forceps to help the baby out, but not in this case. The next step is to apply pressure around the baby's head to assist us in removing the baby from the uterus.
Por aquí sale el bebé. Dios mío.
Before we completely remove the baby from the uterus, use the suction bulb to suction fluids from the baby's nose and mouth.
¿Quién me metieron?
Now, let's have a baby. Help me remove the baby from the uterus.
Sal, bebé, sal.
Excellent, but we're not done yet. Clamp and cut the baby's umbilical cord in order to detach it from the placenta.
Y aquí. Dios mío, ya. El cordón umbilical no parece muy bien.
It's a girl. Congratulations. Our team of nurses will take the baby to be cleaned, weighed, and examined before allowing her mother to hold her.
Dios mío.
Meantime, we need to remove the placenta.
Dios mío, yo creo que esto no lo vuelvo a hacer nunca en mi vida. ¡Oh!
To finish up, we'll need to close the incision.
¿Cómo queda traumado?
I think we'll go with absorbable sutures instead of surgical staples to reduce discomfort and so that our patient doesn't have to worry about having them removed. You can take it from here.
Dios mío. Dios mío. Y ya me dio sueño, no me quiero dormir ahorita con eso. Me acabo de quedar traumado. Y también aquí. Muy chulos. Ya voy a vomitar. ¿En qué voy a pausar tantito el video y voy a ir a vomitar? Ay, no. Dios mío, Dios mío, Dios mío. Acabamos de regresar después de unos 10-20 minutos vomitando yo. No sé ustedes si habrán pausado y se habrán ido a vomitar. Pero seguimos siguiendo esto. Yo me acuerdo que a esta parte se le llaman punteadas. Tenemos que después cortar esta y el otro. Y después quitar las puntadas del otro. Así con unas tiras. Y sacando una por una por una. Así se va a sacar todo.
You did an amazing job. Now, the recovery process begins. Since it may take a while for our patient to recover from the surgery, her physician recommended that she plan ahead by getting people to help her with daily tasks, such as grocery shopping, cleaning the house, or yard work. It takes roughly 6 weeks for the C-section incision to heal, and during this time our patient can expect some fatigue and mild discomfort. It is also recommended that during the recovery period, patients get plenty of rest, drink lots of water, and avoid intercourse. Our patient will need to contact her physician if she experiences any signs of infection, foul-smelling discharge, painful urination, or leg pain or swelling. It is also highly recommended that she contact her physician if she is frequently depressed, as this may be a sign of postpartum depression. And that is a C-section. I think you should test your surgical skills in another surgery here on surgerysquad.com.
Oh, Dios mío, yo creo que es suficiente cirugías por un día. O si voy a hacer esta o esta, no quiero ni pensarlo. Todavía no la paso, ya también me comí algo más. Bueno, chicos, esto es todo. Fue la peor cirugía de mi vida. Espero que la vaya muy bien. Feliz año nuevo igual. Que ya estamos en enero, ya casi terminando el mes. Suscríbanse, comenten, denle like. Chau, chau. Ay, qué asqueroso. Oye, entonces surgir podría grabar esto a lo mejor. A lo mejor luego hacemos esta. Bueno.